Hello and welcome to our third live Tell Me More About session of this evening. For the next 20 minutes, we'll dive deeper into the topic of orthodontic implant migration with Kathrin Becker. And now I must admit, the first time I heard about the title of this session, I seriously thought it was a mistake. It didn't make sense to me because implants are fixed, stationaries, that's it. But tonight we will find out whether indeed migration is possible, the relationship with the applied force and the clinical application of this. And remember, just like with every Tell Me More About session, we are live. I have my laptop here right at my desk. So if you have a question for Kathrin Becker, make sure you submit it in time so I can relay it on your behalf to her. Now, Kathrin Becker is now joining us live from Germany. Good evening, Kathrin. Thank you for being with us. Where exactly are you? Because that looks really neat.
Yeah, good evening, Garrett. It's very nice to see you on the screen. Unfortunately, I'm not with you in Paris due to the current situation, but I'm indeed in a very nice studio in Hamburg. And hopefully the connection is quite good, so you can hear me perfectly.
I can hear you very well, and we are very glad that you're still able to join us tonight via this live connection. Now, you are a senior clinician at the Department for Orthodontics of the University Hospital in Düsseldorf, Germany. So let's get started. Tell us, Kathrin, implants are supposed to be stationary stable. Is that really true, or can they migrate in bone, as has been recently reported by some authors?
That's the question of the evening. And of course, implants have been supposed to be stationary stable. But recently, observations, especially in orthodontics, revealed that they might be susceptible to forces of low magnitude. And I brought a clinical example for you. And over here you can see that we wanted to distalize the molars. But what happened instead, or also, is that these implants were mesialized. So they changed their position in bone. And interestingly, when we removed them, they were not loose, they were still stable. So that rose the questions, did they really migrate in bone?
Yeah, and what would you say, or what does science say is the explanation? Is it due to the compression of the bone, or does the bone really remodel?
That was a question for a long time, and we tried to answer this question in a clinical or preclinical animal study. What we did is we placed two customized implants in a single rat tail vertebra and connected them with a spring that holds together the two implants. And we applied different forces, you can see them here. And we were interested to see whether they really changed their position or whether they remain stable in the bone.
Okay. And animal studies normally only show the final position of the implants. So how do you know whether the implants really shifted their position in this case?
We used a rather new technology called in vivo microcomputed tomography. And what this technique does, it provides high resolution images of up to 10 microns, and we can put the animal into narcosis, we can monitor the vital parameters, and then we can scan the animal directly after surgery and at different time points and superimpose the images. And with this technique, we are able to analyze whether the implants change their positions or whether they remain stable in bone.
And what did you find? Did the implants really change their position in this case?
Indeed, they did, but not all of them. We had some passive forces in the control group, and over there, the spring was just passively attached, so just the spring was moving. And when we had lower forces, we will see something very interesting. You can see it in the upper right. And there was just a movement of the implant tip in the cancellous compartment. But when we had higher forces, and you can see it especially here, then we had also a movement of the implant neck, which was located in the cortical compartment of the bone tissue.
So, and how do you know that this was a result from the bone remodeling specifically?
Yeah, we superimpose the images, and over here you can see week 0. Then you can see superimposition. Silver is week 0, and the other color is week 8. And over here you see week 8 only. And what we found is that we have bone at the former implant position.
And did you in this case also look at the histology? What happened there?
Sure. And what we were seeing were osteoclasts in the zone of compression, but also you can see it here in green, osteoblastic bone formation expressed by osteocalcin.
Okay. And how much did these implants move? And did the movement actually decrease over time? What happened if you looked longer?
That's a question. Why do you think that it is decreasing? But you're right.
Well, yeah. Well, I can imagine that if bone starts remodeling, at some point forces become stronger and it stops, right?
Yeah, and that's a big difference to orthodontic tooth migration. And indeed, you can see over here on the left, that's the anterior implant, and that remained rather stable, especially for the low forces, whereas the posterior implant moved a little bit more inside the bone. And what we could also see that there was an increase in the beginning, but then forces were constant, but the implant movement decreased over time. And the overall movement was higher, of course, in the high forces group, and it was lower with the lower forces that we applied.
That's a very, very interesting outcome. Let me invite our audience who is still joining us that you can still send in questions via the platform for Kathrin Becker about these remarkable results that you saw in these animal studies, Kathrin. So I see a first question from Jona, who's joining us. He says, isn't what you're showing us here just the definition of implant failure?
I would not say that it is implant failure because the implants really moved. And implant failure would be more a failure that involves an inflammatory process or bone loss. And we observed this sometimes for the very high force, 1.5 Newton. So there were some implants which had this observation, but most of them really shifted the position. So at the moment, it seems to be an interesting phenomenon. And it is not yet known whether there would be a higher force, which would then lead to rather an implant failure.
Yeah, because you refer to it's not yet known. Is your study, the one that you present here, the only study that shows that there can be moving implants in the bone? Or are you aware of other scientific findings like this?
Oh, there are some clinical studies that used lateral cephalograms, but in human we cannot apply 3D imaging techniques or radiography in patients. It is not allowed due to the LRA principle. So these studies are limited to animal studies. And as far as I know, this is the first study on that topic, and I don't know any other study investigating this so far.
Oh, wow. So this is really new here. It's the last Tell Me More About on the 4th day of EEO Digital Days. But it's quite exciting stuff. I have a question from Neda Moslemi, who wants to know, when had been the beginning of the orthodontic forces in this animal study? Before or after the Osseo integration?
That is a very, very interesting question. And what you are still seeing on the slide behind me, there was one implant, the anterior implant, which moved less, and the posterior implant moved more. And that indicates something. The higher the BIC, the lower the movement. And we applied the force immediately after implant insertion. And maybe there would have been an effect if we would have been waiting for force application.
Exactly, okay. So you applied immediately. Now, did you also have a chance to look at the impact of the implant surface? Does that have an impact on the movement that you can achieve or that happens?
Yeah, and that's not easy for these very small implants that have been used in the study. And our roughness was 0.8. And that is minimal rough. And from Anne Vanderbeck, for example, we know that for higher surface roughness, we have a higher degree of osseointegration. So we could translate this finding and say, okay, if we had a higher BSC, maybe there would have been a lower amount of implant migration. But on the other hand, the implant migration was high directly after force implication. So in the bone tries to find a new optimal bone remodeling that was also seen, and the bone became thicker. So in the end, at the moment, we do not know what would have happened with rougher surfaces.
No, but you have some expectations. Will you develop this study further? Will you do more research into this?
Yes, what we would like to do and plan to do is to investigate the impact of surface roughness and also the impact of the time point of loading, which seems to be very important for this topic.
Yeah. Now, and related to the results you present, because they were in animal models, why did you use the rat tail as a model? And what does that mean for the translation into the human context?
This is another very, very interesting question. And the reason why we selected the animal model is, of course, that we cannot go into human. If you go into larger animals, you have the problems with the micro in vivo computed tomography. You cannot place these animals inside the scanner, so we cannot analyze the bone remodeling process. And then if you look at the small animals, you have a problem if you use the skull or the mandible or the upper jaw, because over there you have a lot of cortical bone, but not that much cancellous bone tissue.
Exactly. So that's why you chose for the rat? Yeah. But what does it mean for the translation?
That's the reason why we... Yes, and that's the reason why we selected the tail, because the tail has a cortical compartment and a cancellous compartment, and from our understanding, that translates better to the human model compared to, for example, the mouth of a small animal. But indeed, the question is, how can we translate it? The implants are smaller, and it's an animal study. Remodeling is faster, so it would be very, very nice and interesting to see the results also in human and to perform a study. But this is, of course, very complicated due to all the regulations with, radiographic images.
Exactly, clear. Well, there's a lot of exciting work to be done, I think. I have a question from Reza Khosravi, who I think has been joining us all night because he's tying the Tell Me More Abouts together. He writes, as implants can now be moved orthodontically, as you show, then should we be able to place implants in younger, still growing implants? Let's tie these topics together.
This is another very interesting question, and what we can see if you have a child and you place an implant in a growing individual, you have the problem that the bone is still growing. But why is the bone growing? Also because of the teeth, which are usually there. But if you don't have a teeth, you can see it, for example, after a trauma. There is no growth or no vertical growth at that position. And you have the same observation with implants. But at the moment, we do not know what would happen if we would pull at the implant, or if there is, for example, an option for destruction osteogenesis. But that would be interesting topics to investigate in the future. But I think what we can learn from implant migration cannot be translated into the question, can we place an implant for a long-term restoration in a growing individual? And from my personal opinion, we have to strongly look at the patient and see, is this a patient that does not have any teeth, or is there just a single tooth missing? And this is a completely different situation and needs a completely different clinical treatment plan.
Exactly. Because it's interesting if we really tie the Tell Me More About together. I don't know if you joined us already at 7:10, Kathrin, but then we heard Kirsten Heimesdottir tell us that she, as an orthodontist, actually uses the implant because they're so stable to move the teeth around. So how can we combine these two insights?
That's also a very good question. And of course, we are using the implants a lot. we're using them, for example, if we want to stimulate growth of the maxilla, because we do not want that our molars also move or that they are mesialized and we have side effects from our anchorage. And for that purpose, orthodontic implants are really helpful. But when we place them, I think it is essential to consider that they might shift their position, and that becomes particularly important if we place them between tooth roots.
Yes, exactly. Then this is something we should keep in mind. And this is closely related to a question I see coming in from Saad Yassin Nori Yawari. And if I'm correct, I think he's joining us from Baghdad for 3 nights in a row at least already. I saw your name before, Saad. He asks, so make it really clear to us, Kathrin, what is the clinical importance of this study? How do I translate this into my dental practice?
I think there are 2 sides. On the one aspect is we have always to keep in mind when we place an implant, we place it into a living system. So we have to consider how much bone do we have, and we have also to consider that if we apply force immediately, the bone to implant contact will probably, and this is also shown in our investigations, become higher. So immediate force application seems to be relevant. If we have, for example, a non-passively fitting superconstruction, that could be also an effect, and maybe, and this is also not investigated, would be interesting, especially for non-orthodontic or for dental implants, there could also be a change of the implant position. And I heard about clinical observations in this topic, but as far as I know, there are no very well performed clinical studies investigating or observational studies to investigate this topic, and that would be interesting for the future.
Exactly. Well, let's use the fact that we are now online with hundreds of people all listening and talking about this, that maybe some people should dive into this. Your last answer is very closely related to a question from Aslan Yassar Gogbuget. I hope I pronounced that correctly. He's asking, if one implant, for example, in the buccal position, is it possible to correct this? And how about anchorage? What do you think? Obviously, you haven't done that yet, but if you extrapolate your results to what you think is possible.
I think it depends on the time point. So if the implant was just placed, maybe there's higher chance than after a certain period of osseointegration. But as I said, we need further research to investigate the impact of the time point of force application. And maybe there's an option to combine our findings that there is a possibility of movement with an option to stimulate the bone, for example, through perforation, and further facilitate the movement of the implant. So that would also be a clinical option to do that. But there is no experience in that topic.
Exactly,
it's
all
new,
very
so
new,
we
very
need
new.
further studies.
Yeah, I see a question from Eric from Nantes who wants to know more about your study. He says, was there cementum detected around such implants? Those who move, did you see cementum?
No, there was no cementum.
Okay, that's a very clear and short answer. Thank you for that. Last question. Saad is adding to his question. Do you wait for osseointegration to happen first? This is about timing again. Maybe you missed that. Before applying the forces to the implants?
So I did not get that question perfectly.
So he asked, do you wait for the osseointegration to happen first before applying forces to the implant? But I think you already earlier told us that you load immediately.
That was why I was asking, because I was not sure if I got the question correctly. And no, we did not wait for osseointegration. And in orthodontics, it's quite usual to use the implants immediately after installation.
Exactly. Well, Kathrin Becker, this has been fascinating. Thank you very much. Now, to summarize for our viewers, what would you like them to have the most important message that you want them to remember of this session?
I think with the limits of this preclinical animal study that we performed so far, we were seeing that implants can actually or seem to be able to migrate in bone, and they were susceptible to constant forces or orthodontic forces of a low force magnitude. And what we were also seeing is that after loading, the movement decreased, and possibly this was associated with the bone-to-implant contact, which became higher over time. And I would say for the future, it's very important to remember these concepts and to keep in mind that bone tissue is a living tissue. It's vivid, it changes over time and adapts to the local forces that you have. And when we place implants, either in prosthodontics or in orthodontics, we should keep this biology in mind and that we are working with a living system.
Wow, very strong summarized. Congratulations on your study, and we're looking forward to more work from your end. Thank you, Kathrin Becker, for spending the time at 11 p.m. on a Thursday night with us. And thank you all for your super active participation tonight. In case you submitted a question which did not yet get answered, you can now, for the last time in these EAO Digital Days, continue to chat with our expert, Kathrin Becker, and with the other participants in our Channel 8 Tell Me More About After Discussions Chat Lounge.